Mine isn't either.
What's your last name?
Giovinco.
Giovinco.
Yeah.
Joe Giovinco?
Joette, actually.
Joette?
They shortened it. They didn't think any of my name was usable.
Joette Giovinco. Very nice. Italian?
Yes.
Oh, wow.
Yeah. The chair of infection. Okay. I just said they've got infectious disease specialists from the University of South Florida and Tampa General Hospital. Pretty far away, but I think I can do it. No. I know. I know. And see, and I can't read with my glasses on, so I'm going to take my glasses off then to read because.
He's like, this is so hard.
Well, I never lost my ability to read because I am so nearsighted. So if you're really nearsighted, don't worry, you'll never need reading glasses.
Can you say your name and count to 10, please?
Seetha Lakshmi, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay.
Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay.
So who's going to run prompter?
Yes. Press the talk, please.
Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3.
Okay, here we go. Stand by. You're going to be on 10 minutes before you start.
Hello, I'm Dr. Joette Giovinco. We know that you have a lot of questions about the coronavirus, and we wanted to provide you with information during this webcast. We're going to be talking to Dr. Seetha Lakshmi. She's an infectious disease specialist from the University of South Florida and also works with Tampa General Hospital. Our producer, Kristen Moore, she's off camera. She's going to be asking us some of the most frequently asked questions about the coronavirus and some of the questions that come in from you. We'll try to get to as many as we can. And you know, I think I've had some questions as well. I've heard lots of things. I've been watching China a lot. I've been watching Wuhan, and there have been discussions about airborne, the possibility that the virus might be airborne. And in fact, they went so far as to say that companies and manufacturers have to make sure that their HVAC systems take in fresh air only, they must circulate in single rooms, and they also need to shut down HVAC systems when someone tests positive. However, you know, from the WHO, you're hearing that, well, there may be some airborne spread. It's really mostly in confined spaces. We hear a lot about that and the concern for healthcare providers. Have you heard anything?
So that's a great question. I think that also alludes to the point how much is still to be learned about the virus itself. As you know, coronaviruses are a group of viruses that are part of the beta coronaviruses. And some part of those group has been around, and we know they spread through droplets. Mm-hmm. Since it's part of the same family, I think it's reasonable to start at that point that it is likely droplet. But as we go much farther down the investigation with epidemiology, we'll understand a lot more about the spread. There are still many unknowns, as you know, about the transmission modes, including presence of viral particles in the urine and stools. So we're still to understand, are those alive viruses or dead viruses? So there's a lot of gray area. But I think the priority has been to make sure the transmission to healthcare workers, especially when there was an outbreak in Wuhan, we've learned a lot from it. And airborne is part of the prevention for anybody taking care of patients in a healthcare setting. So if you look at the guidance documents, they often comment on you have to have droplet, you have to have contact precautions. That is basically touch, right? So, and the last one is airborne. So making sure that all your healthcare providers are wearing the right masks, which is fitted properly, so they can care for the patients with COVID-19.
That's really something we also need to talk about, our masks. I think people really have the feeling, or they feel this sense of safety when they're wearing a mask, but that's not necessarily going to protect them in the general population. But we know that for healthcare providers, they wear respirators. Those have to be fitted. You can't have facial hair. There's so many ways that those can fit improperly, and I think people just see them, they think that they need them, and they're purchasing them, and unfortunately what's happening is there's less of a supply for the people that really need them, and those are the healthcare providers on the front line.
Yes, absolutely. The most important point, it also provides a false sense of security sometimes. You know, the most important thing is to make sure your hands are clean, because on an average a person touches their face 300 times an hour sometimes, so it's like a huge number. So if you wear a mask, and we know as healthcare providers when we do have to wear a mask, you tend to reflexly touch your face much frequently because you're trying to adjust the mask. Although we are trained, you know, with the mask how to wear it and how to take it off, but general public is not aware of how to wear the actual N95 mask. There are so many caveats to it. If it's not properly fitted, it selectively draws air from the sides, right? So there are many considerations before you actually go ahead and purchase an N95 mask.
Now, a regular surgical mask, I have heard that could be recommended for a person who is sick. So that would keep those droplets from spreading to other individuals. But again, it has to be changed frequently when it's wet. It has to be taken off in a certain way and disposed of very carefully, because you could infect surfaces or another person during that process.
Correct, absolutely correct. And much of it, since this epidemic has been so new, and the ways we have to tackle it, the information coming from so many sources, I think it's not unsurprising that we've had so many different aspects of, you know, should I wear the mask, should I not wear the mask? It's a very important aspect to tell. I tell my patients often, you know, I get this question, and I say, if there's one thing I could do, I would make sure that I wash my hands frequently and don't touch your eyes, nose, or mouth without washing your hands, because that's the most common route that we know of. And then patients who are sick, like you mentioned, wear the mask, and that's the best way for them preventing it to other folks.
Okay, we're going to start with the first question. Christian?
Okay, so we're going to start with the basic. What is the coronavirus?
So coronaviruses are a group of viruses that have been around the block for a while. We know them as a group of viruses that do cause common cold, and humans as a species have experienced this for a long time. Now, among those groups, there are 3 new ones now, including the newly named SARS-CoV-2, which is a novel coronavirus, and in that similar category are the MERS-CoV and then the SARS-CoV. We know a lot more about them because of some of them have caused much more severe illnesses. So the group itself has been known, but the new ones are the ones that have garnered a lot of attention because they're new, but also because some have caused really severe disease.
And these newer ones have come from animal species. We believe that they have kind of made the jump from animals to humans, which they can do, but then they spread from human to human, and that's what kind of makes them very distinct. And you know, there's a lot of speculation as to where they've come from. I know that bats are really one of the sources that we think they might come from, and then they're spread to another animal perhaps. Maybe the animal encounters some of the feces of the bat, or something else can happen that would infect the other animal, and then eventually this virus evolves, and then it's able to infect us, and we're able to spread it from person to person.
Yeah.
Okay, and what are the symptoms?
You know, the primary symptom that I'm seeing over and over again is fever. Fever was number 1, cough was number 2. We also see myalgias and shortness of breath. Certainly the people that have a milder illness, and correct me if I'm wrong, they probably have those mild symptoms. They would have less of that shortness of breath, but when it starts to cause a pneumonia, then that might cause more serious types of symptoms.
Yeah, yeah. So to add, coronaviruses as a group have some similar characteristics. So they tend to cause predominantly respiratory illnesses. That's what Dr. Joe was talking about: sore throat, cough, shortness of breath, and pneumonias. And some of them in that same group can also cause GI illnesses, diarrhea. So in the part of the epidemic when you're tracing the symptoms, you can see that some patients also reported diarrhea early on, before some of the respiratory symptoms started, which is not out of the realm of the coronavirus. Is what they normally like to do. So that's not uncommon to see as well. But predominantly symptoms tend to be upper respiratory, like a sore throat, followed by a dry cough, fever, and shortness of breath.
And I remember reading about at least one patient that was mistakenly thought to have an acute appendicitis and was taken to surgery. So it can present in very unusual ways, but certainly we'll have more and more information as we gather more from the patients in China. But it could affect our populations differently. And you know, I've been very concerned about some of the older people, because we have older people in our community, and that's kind of playing out right now is what we're seeing in Washington State, because it's affecting a place, a residential community of older adults.
Yeah, I think that's a very important point. The study that came out from China CDC, which is the largest study we have to date on how the epidemic has affected different ages of population. The good part of it, I want to say, is that children are not predominantly affected. Even when they are, they don't develop severe illnesses. So that's really great news. But on the other end of the spectrum, we have our elderly population and immunocompromised population that tends to bear the brunt of the epidemic. So the numbers from the China CDC study almost in double digits when it is elderly patients greater than 80, so close to 15%.
15%, right?
Yeah,
It's 14.8.
mortality. Yeah, it's very concerning.
It is very concerning.
How is it treated?
Well, a lot of supportive care. We don't have treatment yet. We don't have antiviral therapy that's proven to be effective, but the good news is there are lots of clinical trials going on right now. I think I have my eye on remdesivir. I don't know about you,
Yes.
But there are other antiviral drugs. There was a combination HIV drug that was utilized. And you know what was interesting, when I was listening to these people from China, and they were talking about people that had recovered early on in the treatment phases, and they said 98% had been treated with an antiviral. They didn't specify what, certainly, but it sounds promising to me that antivirals are going to be something that it's going to be beneficial, but again, we need that data.
Yeah, I agree. Right now, the supportive care, most of the time it's mild. 80% of the cases tend to be mild. So staying hydrated, you know, making sure you take enough rest. So for mild cases, that's predominantly the treatment. But when you get severe illnesses, we're looking at many treatment options. Hopefully we'll have more data coming out on the antiviral drugs that will be helpful to treat. Remdesivir is one of the ones that I have my eye on too. So we'll see.
Well, we're going to be hopeful.
Yes.
What can you do to protect yourself?
So the most important thing at this point in time is definitely hand washing. So, you know, I know there have been a lot more attention. There has been a lot more attention to properly washing your hand. So the first step, if your hands are visibly soiled, use soap and water. If you don't have access to soap and water, use alcohol-based hand sanitizer, which has at least 60% of alcohol in it. The other thing is to avoid touching your eyes, nose, and mouth when your hands are not clean. Always wash your hands before you touch your face and eyes and nose and mouth. Coughing. So if you're coughing, cough into your sleeve. If you cough into your hands, wash your hands again before touching your hands and face. Try to avoid contact with sick people as much as you can. I know sometimes that's not always possible. And disinfecting common surfaces. So if you're working at a desk that's commonly, it's a common desk, then definitely disinfecting it with Lysol or any surface disinfectant are some of the common ways to protect yourself. Or staying hydrated as well.
I think some of what I saw out of China, it was pretty much susceptible to any disinfectant. I mean, these are viruses that are not hard to treat. It's not like norovirus. I mean, but I did hear one of the WHO officials say that even just, you know, a diluted bleach solution, a very inexpensive way to disinfect, and then that can be very effective.
It's interesting. The coronavirus has a cover on it. The name corona comes from the crown. So the crown itself doesn't do the virus much justice in this case, because it makes it much more susceptible to surface disinfectants. So that's definitely something we could use to our advantage, to be able to use alcohol-based hand sanitizers to kill the virus.
How does the coronavirus compare with the flu?
It's really not an apples to apples comparison, you know. Flu, I think, as a species, we have seen, as human beings, we have seen flu for a long time. So even if your body doesn't recognize a novel strain of the flu, it remembers from the past that it has encountered something similar. And also we have vaccine that gives you a memory bank. So your immune system says, oh yes, I've seen this in the vaccine before, so I can fight this better. Our body is often better prepared from a novelty perspective. But the new coronavirus is new, so your body has to learn it to fight back. So that kind of makes the comparison hard. Also, the flu, you have a vaccine. For the novel coronavirus, not yet, but hopefully soon. And we don't have antivirals for the novel coronavirus, whereas we have Tamiflu for the flu. So it's hard to compare one-on-one, especially if both of them become very, well, flu is prevalent, but if the novel coronavirus also becomes very prevalent in our community. At this point in time, flu is prevalent. We're having a bad flu season. We're seeing a lot of deaths from it. But the novel coronavirus, or the SARS-CoV-2, if it were to become as prevalent as flu, you know, we'll really see the impact of what it's capable. So that's still panning out at this time.
Face masks, are they effective?
They're effective. A surgical face mask could be utilized by someone who is ill in the general public to prevent them from sneezing or coughing or creating those respiratory droplets that would affect someone else. Again, you have to be careful with those masks, because once they become wet, they need to be changed, and also they have to be you have to take them off in a certain way. You have to throw them away appropriately, because that could cause problems. But you know, as we discussed before, those N95 masks are reserved for people that are first responders or individuals that are in healthcare. They have to be fitted. They are respirators, and so those are things that should be really reserved for those people. As far as protecting you from getting the coronavirus, there is no data to show that in the general public, by wearing a mask, that it is protecting you. And so the recommendations are that you don't do that, but that instead you really, really focus on washing your hands and talk about all the things you were talking about with the disinfecting, and those are some of the ways, and staying away from people that are sick and coughing into your sleeve. Those are all things that we should be doing. We should be doing them anyway, because flu season is here.
That is true.
Who should be tested?
So that has evolved quite a bit. It's been a tough balance between who we want to test as clinicians versus what resources we have available at this point. And it has evolved as the epidemic has progressed. So I want to say, at this point in time, I know our Vice President came out and said, you know, we're going to offer it much more broadly, which is a great first step in getting to a point where, you know, we want to be able to do that. And I think it sets a precedent to say that's where we want to get. However, today the ground reality is, right now, we are trying to prioritize to have the testing available for our sickest patients, who have had direct contact with somebody with a confirmed case. So that way we are able to care for them the best we can.
Can someone who has been quarantined spread the illness to others?
We're still learning a lot about the novel coronavirus. There have been reports in very reputed medical journals of transmissions perhaps occurring before symptoms, and that truly presents a challenge in public health in terms of containment strategies, because being able to contain needs to have a geographic, you know, defined area and people whom we can say symptoms and quarantine. rather than if you have people who have capability of transmission before, that makes it twice as hard. But there have been reports that that's possible.
What they have said over and over again, though, is they think that that's not the driver. An asymptomatic person who might be infectious is not the driver of this epidemic. That it's generally those people that are symptomatic that are probably spreading it more readily. And in fact, there was just a recent article that came out where they monitored about 450 contacts of the first 10 people that were diagnosed here in the United States. And honestly, even household members, people that they lived with, the secondary, what they call secondary infection rate or attack rate was only about 10%. So not everyone, even in their own households, became infected. So that tells us something. But again, those people may have been taking precautions, certainly, but they had to have been potentially with those people while they were asymptomatic and they didn't get sick. So all of those things give me some hope.
Yes, I think thank you. I think we should definitely put in perspective. From a scientific perspective, is it possible? Perhaps yes. But to what extent is it contributing to the spread in the community? It's most likely people who are symptomatic that are spreading it the most.
Okay. What should you do if you come in close contact with someone who has it?
So at this point in time, if you had a close contact with a confirmed case, that is actually somebody who had a testing done and they were told that they have COVID-19, you're going to be monitored. So you're going to be in the radar of the health department, so you're going to be monitored in that setting and be watched for symptom development. So most of the time you're asked to keep a log of your temperature, see how you're doing, and report to the health department, and you're in constant touch, so you're being monitored.
And I think what I saw, the definition of a close contact, and I'm not sure if this is correct, but they're saying that it's someone who has been with that person for at least 10 minutes within 6 feet of that person. And again, when you look at this recent article that came out from the CDC, those individuals, those close contacts, the chance of them becoming infected was less than 1%. I believe it's 0.45%.
0.4, yeah.
If you suspect you've contracted it, where can you go to get tested?
So there is a difference between if you're suspecting you got COVID-19 versus actually knowing. So at this point in time in the epidemic, for patients who actually have had a positive COVID-19 test and their close contacts will be in the radar of the health system. So that is reassuring. Is there a possibility there might be a few other cases? Yes. But at least at this point in time, we know that they are going to be monitored for development of symptoms and get tested right away.
In light of the new case in Florida that's actually quarantined in Washington, how are they determining where the case is attributed?
I haven't confirmed this, but I have seen that if a person is a resident of a particular state, then it's attributed to that state, even though the person contracted it outside that state. That's my understanding right now, anyway, from the governor. And I haven't confirmed that, because what he said in the press conference was we now have 3 cases. He quoted the person from Manatee, the woman that traveled to Italy, and then this last person who's now in Washington State. But the travel companion of the first woman is, I guess, is from California, so she may be attributed to that. But again, I'm not totally sure, and I think we have to just wait and see what the CDC says.
Can the coronavirus live on fabric, carpet, other soft surfaces, and what about hard surfaces?
I think there's a lot we don't know.
Yeah.
I talked to the CDC today, and they said that those studies are ongoing. They have not been completed. So we don't know for sure. I mean, we see these images coming from China and from other places of this massive disinfection. They have driverless cars and backpack sprayers. I even saw a drone that was spraying disinfectant. So I know that the thought is that disinfection is important, and we're seeing that now in New York play out because they've got those 2 cases, and they're going to be doing that in their subway system and also in their buses. So I think that we are doing it, and just thinking but again, I don't think we know how long it lives on surfaces yet. Which is surprising to me. I don't understand why we don't know that.
It's a good question, because there's so much variability in the type of surface and where the surface is. Is it subject to sunlight, atmospheric pressure? So there's so many things that affect the longevity that it's hard to have one right answer for that. But we have to wait and see what the studies show.
We just got a question about theme parks and other public gatherings. You know, how do you sort of protect yourself, or what should you be aware of when you're going to different places?
So that's a great question. We have to see how the epidemic pans out in our communities. At this time, it's too early to say. If it does get to a scale where we see community transmission, then we definitely have to start thinking about not being in large gatherings. That's part of social distancing strategy. But you know, this is we're seeing the story unfold. We'll probably know how things transpire, and we'll probably be able to advocate and educate our community better. But I think right now it's too early. However, if you are going to a large crowd, just, you know, you have to make sure that you definitely common surfaces that you touch, you wash your hands, and same basic principles of cough etiquette and staying away from people who are sick.
And you know, I just traveled to New York, so we took the subway system. We were in very crowded cars, and basically I just kept that hand sanitizer in my purse, and I used it quite a bit. So hopefully, you know, and that was honestly too, I was worried about influenza as well, although I've had my influenza vaccine. So that's just basically what I think that's all you can do until someone perhaps does designate that we do need to implement some of these safeguards with social distancing.
Well, it also brings up travel plans. You know, a lot of people are going on spring break coming up, and should you cancel your travel plans, or, you know, what should be prepared for if you are going to get on the plane?
Yeah, I can definitely say it has affected a lot of travel plans, including mine, and yeah, a lot of friends and family. If it's non-essential travel, I think it's fair to say at this point that it is best to avoid it. If you're going to travel, you have to do it, then there are some common things that you can use that have shown will help decrease respiratory viral illnesses, including influenza. So when you're going to an airplane, right, you sit down, make sure you wipe down the immediate area around you, including the windows and the food tray. So make sure you wipe it down. Stay hydrated. So you don't want your nasal mucosa to dry up, and that makes you more susceptible. Alcohol, caffeine, all of them dehydrate you a lot, so perhaps not the best idea. So staying hydrated, wiping down the surfaces around you, and trying to not touch your eyes and nose and mouth. Interesting study was done, and I think we talked about this in the past, that the most protective seat, or the seat that probably affords you the most protection from getting sick, is the window seat. That's mostly because of the traffic. You know, if you're in the aisle seat, you have traffic going, you know, people going in around you. So you're kind of out of that zone of transmission from the walking traffic, like 1 to 2 meters. So, you know, some things that might be in your control to do when you're traveling.
Okay. And we just heard today also that if you are traveling to an area that is affected, certain areas that the airlines are now going to waive some of those change fees. So if you did have a trip planned to some place that you're very, very concerned about, there might be an option there to postpone it.
Okay, how does season change impact the virus?
Good
So
question.
we're hopeful, right?
Yeah.
We're hopeful that the season change will impact the virus. However, some of the things that do contribute to seasonal variations also has to do with us as host. So basically what that means is that in cold weathers, you tend to have dry nose and nasal mucosa is dried up, so the viruses can attach easily and they don't get trapped easily. So that's how you kind of tend to get more of the common cold and the flu. And there's sometimes more indoor crowding as well during cold seasons than being outdoors. So that aspect of it, you know, is not going to contribute a whole lot with the seasonal change, but we're hopeful that it will help, but only time will tell. I think it's too early at this point to be able to say it's going to change, but
I know.
Fingers crossed.
Same here. I'm very hopeful, but there's no evidence to show that it definitely will. So we have to wait and see.
Questions about animals and coronavirus?
Yes, yes. All animals have their own coronavirus species.
Yes,
I mean, they're in
so-
cats, they're in dogs,
yeah.
they're in bats, they're in all kinds of animals. What made this one unique is that for whatever reason it gained the ability to jump basically from an animal to human, and then also had the capability of spreading from human to human. So that was really the key difference in this particular coronavirus. But there are cats that have a very severe form of a coronavirus, and we have a researcher that has looked at a drug that's very, very similar to remdesivir. It's kind of the feline version of it, and it is curing cats. So, so yes, animals can get coronavirus, but it's usually confined to that species.
Right. So I absolutely agree. The bats, the coronaviruses that have lived in bats for forever and ever, as long as we know, and there is what we call an intermediate host, right? That the species jump happens from the bats to a cattle or a pig, and then from then on to the humans. Now there are probably multiple opportunities, but that doesn't always happen. When a successful species jump happens, it's a huge landmark in evolution for the virus and now human species as well. So it's very interesting how it is able to make its own glue and bind on to the human lining of our breathing tubes. So it's very very unique, but also it tends to make mistakes when it makes that glue. So the researcher is looking into opportunities to exploit that, so that we can either prevent the binding or take advantage of that mistake it makes.
Yeah, in this particular case, they are looking at a very endangered species called a pangolin. So there's a thought that maybe it went from a bat to a pangolin, but they think there might be other intermediate hosts that they have not yet identified. So we're still waiting to hear that information.
Yes.
So we've got a lot of people asking about Amazon packages and mail. Would you recommend the same for those as any other surface?
So if you look at the evidence for surface disinfection for common respiratory viruses, there have been studies done to see how effective is it to disinfect surfaces in preventing common respiratory viruses. The evidence is graded as moderate. At a time like this, when we are dealing with a novel epidemic, it is definitely not a bad idea to disinfect commonly used surfaces.
Should you accept packages from China?
I have.
I haven't thought of it.
Yes, I know my sister got one and it said Wuhan, and she was like, "What do I do?" But yes, all the guidance right now from the WHO is really suggesting that there is no evidence that it can spread that way.
Yeah,
They said that the amount of time that it takes for it to be packaged, processed, mailed, shipped, most of what we're getting here may be coming from warehouses here in our own country, but certainly if it is coming from China, there's a very long transit time, and so everything that I have heard is that it's extremely low risk. No one can ever say it can't happen, but they come close to saying that.
Yeah, that's a good point. I definitely agree that surfaces that have been for so many hours out and about are unlikely the common sources of spread. The surfaces, when we talk about spread, are surfaces that sick people have been in contact with frequently. So packages, food items that are coming over from China, so far official guidances have suggested that it's not the source of spread.
Can you get coronavirus more than once?
That's a good question.
Right. I think the study, and Dr. Joe, please jump in if you feel like there is more data to this. The one that I read in JAMA more recently suggested that there was shedding of the virus after recovery. But is that reinfection, or they just shedding? It didn't seem like that symptoms afterwards. So there's still a lot of unknowns, but so far it doesn't seem like we've had patients who have reinfection, but that's still out for debate.
I agree with you. There were a couple of question marks on some of the cases, and they weren't sure about the testing, and so there was this thought that someone could potentially shed, again, not knowing how viable those perhaps those viruses are. But certainly I think that that's more information that we need and hopefully we'll get over time.
For those just joining us, can you go over the best things to do daily to prevent becoming sick?
So there are some things that we can take control and take charge and be able to protect ourselves, our families, and our communities. So the common things: stay hydrated, wash your hands frequently, don't touch your eyes, nose, or mouth without washing your hands, staying home when you're sick, but also avoiding contact with sick people who are sick, being able to disinfect surfaces that if it's a common surface that you use in conjunction with somebody else, or public surfaces that you use commonly, be able to disinfect that, are some of the common things that you can do.
Another question coming in: can mosquitoes carry it?
No. No. There's a lot of unknowns, but I've not heard of that.
I've not heard it. And it's really not being isolated from blood very much. I mean, we just looked at some of the studies, and
Right.
it would be very, no, I don't think so.
Food, is there any tie to food in coronavirus?
So far, we don't know that has happened. The predominant mode of spread is this virus needs to be able to bind to your mucous membranes, or the lining of your lungs and your throat. So it's not a common mode of spread, but we're still learning about this as we go.
How deadly is this coronavirus?
So it depends on what age distribution we are talking about. It's not uniformly something that kills a lot of people. It depends on what age and what comorbidities you have. So the younger you are, so young children have very low risk of severe illness, whereas on the other end of the spectrum, right, so people who are older have hypertension, diabetes, heart disease, tend to bear the brunt of the disease, as well as death rates from it.
Yes, I mean, the numbers really speak for themselves. So that the death rate was about 15% in 80-year-olds, plus 70 to 79-year-olds, 8%, 60 to 69-year-olds, 3.6%, and 50 to 59-year-olds, 1.3%. So compare that to that overall thought about influenza. We're talking about maybe 0.1% overall. So you think about that, 0.1% in influenza versus 15% in someone who is over the age of 80. That's a huge difference. I mean, that's magnitude difference.
I agree with you. It's the dichotomy, right? So the younger kids, younger you are, it's okay, but then older you get, it's worse off. Now influenza on the other hand can have much more of a severe impact on pregnant patients.
Yes.
So this we have not seen that happen, that it's not as fatal or severe in pregnant patients. To date, we don't know of vertical transmission occurring, which is, when I say vertical transmission, it means a mother giving it to the baby. So that we have not seen while, during delivery, that has not, we haven't seen. So there are some good aspects of it, I think, still that, that's compared to flu, it tends to be much more severe in pregnant patients. And some of even the younger adults tend to get it really severe.
But as we said before, there is a vaccine for influenza. There are antiviral therapies that are effective. We don't have that for coronavirus.
Right.
And as far as the vertical transmission, I mean, that was really good news because we heard such horror stories when H1N1 or the swine flu became an epidemic or pandemic of these women who did so poorly during pregnancy. And we're just not seeing that. And in fact, there was one case where they were very concerned. It was a 36-hour-old baby that became infected, so they were concerned there might have been this vertical transmission, so they went back and started to look at other cases, and they said, no, we really honestly aren't seeing that, so this baby may have been infected in a different way.
How about blood transfusions?
I haven't heard of any data about it yet.
No,
so
me either.
Yeah.
Does using antibacterial soap make any difference?
For washing hands, yes. Soap and water, yes. the best you can do, the better of a job you can do washing your hands. The whole 20-second washing, making sure you don't miss the thumbs and the tips of your fingers and in between. I think there was a mention of the happy birthday song,
yes,
twice for 20 seconds. That's truly protective to be able to get all the germs off your hands.
If they mean the difference is it okay to just use regular soap? I don't think you have to use an antibacterial soap. I haven't seen any data on coronavirus, but in general, there have been many studies that have shown that soap and water is just, it's soap and water is effective. So that's really the best thing to do. Wash your hands.
If I've come in contact with someone who is now under quarantine but has not tested positive, should I take any action?
The important thing is that you monitor your symptoms. Definitely check your temperature every day and follow up on how you're feeling. If they've been in contact with somebody that is under quarantine and tests positive, they're definitely going to be offered testing.
Okay. And you touched on this a little bit earlier, but just in case people are joining us, we're just getting it in. Is there a vaccine?
No, there is not a vaccine yet. I've heard that there are 20 potential candidates in development. It's going to take a great deal of time to get them out there. I think they're very hopeful that we might get one in the next 12 to 18 months. That would be a record-setting vaccine. So there's a lot of hope out there, but no, there is no vaccine right now.
That leads to, what should I do if I come down with the symptoms?
So the symptoms are not distinguishable from the flu or the common cold. If you have fever, runny nose, and common cold symptoms, which are, stay home, don't go to work, it's hard to differentiate those symptoms from actual COVID-19 symptoms unless you've had contact with somebody with actual COVID-19. Now, if it's more than a common cold, that is, you have difficulty talking in full sentences, that you feel you're short of breath, and feel unwell, that you can't breathe, those are the points that we definitely want you to, seek attention right away. Of course, you should call your healthcare provider if you have any health ailments, and they can help you. But the danger signs, especially not being able to breathe, breathe or speak in full sentences, those are signs that we take very seriously and investigate much further.
And we are still in flu season, so the symptoms can be very similar, the fever, the cough. So it's still, you may have the flu, so you want to make sure you don't have that. And if you're one of those individuals who may need antiviral therapy, you're going to want to start that. So you could, use a telemedicine or talk to your doctor or find out if you need to get a test for flu, because again, I think that I'm kind of hearing that from some of the primary care docs, is they're seeing people with these symptoms, and it is flu.
Yeah.
Okay, another question coming in. How and will this come to an end?
I wish we had the crystal ball to answer that question. There are multiple strategies that are being employed at this time. So you've heard a lot about quarantine, containment strategies that's going to help try to prevent the spread. Once we start seeing the spread, of course, we try the best to take care of our sick patients. When you're sick, stay home so you don't spread it to others. And then hopefully the vaccine comes around and an effective antiviral treatment comes around. The natural story of most epidemics is the population develops immunity. And that's kind of how it's been for ages. But now we have ability to make vaccines and antivirals. So hopefully all those come together and help us get ahead of this eventually.
Another question coming in. Is there a way to tell if you have already had coronavirus, but maybe you thought you had the flu or a cold?
There are serological tests out there now, I'm hearing. So there are tests out there where they can measure antibodies in the blood. However, they're not widely available. They're really only being used right now in research. They're looking to see, and actually this is very exciting for us because it means that we're going to be able to look at a population at large. We're going to be able to kind of assess maybe how many people might have been infected, and that's going to give us a much clearer picture of death rates and lots of other things. So technically there is a test, but it's really not being utilized for that at this point in time. That might change, right?
Yeah, true.
Where in our area are test kits available right now?
So in the state of Florida, we have 3 state labs that are up and running since Saturday to be able to test. There is 1 in Tampa, Jacksonville, and Miami, so 3 altogether. As we go forward with this epidemic, we have to see how much capacity and how we're able to handle the amount of specimens that are submitted.
Another question just coming in. For those just joining us, a lot of people are asking if it's airborne.
We don't think that's the primary mode of transmission, but I really think there's probably some aspects of it that will make it airborne. I'm just not sure what they are. I mean, one of the things that's quoted a lot is the concern for healthcare providers when they're doing tests. They're putting, scopes and tubes down people's throats, and they may be aerosolizing at that point in time. I have heard some reference to it in China where they were talking about worrying about HVAC systems or heating and air conditioning systems. But again, I've not gotten any concrete information on that. I don't know if you can add.
I think it's important to understand what airborne means because in the medical language, when we say airborne, we refer to something versus droplet. So droplet, so the modes of transmission, there is droplet, there is airborne. So the droplet basically are, if you cough or sneeze, you're going to have small particles that come out and then they don't travel a long distance, they fall down. So that's called a droplet spread. Now when we talk about airborne spread, when you cough or sneeze, those particles are much smaller and they remain in air suspended for a long period of time. So the typical example for airborne transmission is measles. And to just give you a context, measles, one person who's infected with measles can spread it to 18 other people. Versus the COVID-19 disease, we know, as far as we know right now, 1 person can spread up to 2 people. So that's usually in the range of droplet, not as much as airborne. So when we're talking about airborne, we're talking about those tiny particles that stay in air for a long period of time. So there might be, I agree with Dr. Jo, that there perhaps is a component of airborne, but how much is it contributing to spread it's not completely known. But based on what we know about coronaviruses, it perhaps is more droplet than airborne transmission.
And that's what I keep hearing.
Yeah.
Yes.
What medicine or treatment is used at the hospital to treat patients?
At this point in time, for COVID-19, we do not have a proven treatment. So if you develop a bad infection with COVID-19, our primary strategy is to support your body. Fluids, nutrition, oxygen, these are all parts of supporting your body naturally fight the infection. There are drugs that are, the trials that are ongoing, which we're watching very closely. You can get what we call an investigational drug approval to get the drug into the hospital for remdesivir. It's called an investigational approval use. So that's something the hospitals are looking into, trying to get the drug to see if they have a patient, to be able to give the patient that drug.
And they did that for the first patient that was diagnosed in the United States, the person that was in Seattle.
Yeah.
And he was a 35-year-old male. He was he started to deteriorate, and they gave him remdesivir, and he improved the next day. Now, was the remdesivir responsible for that? We don't know, but it's promising, and that's why I have my eye on that medication.
I agree.
What about elementary schools and kids? What do parents and students, teachers need to be aware of?
Well, it just doesn't seem to have the effect on children that it does on adults. And I think there are some theories as to why that's occurring. the recent WHO group that went to China, they believe that children are probably getting infected. They just don't respond in the same way to the virus. And we have to remember this virus is not, I mean, it is attaching to the lungs or to the lining in our respiratory system, but that's causing a reaction. Our body is reacting to that by producing inflammation, and it's that inflammation that's really causing that severe illness in individuals. And again, that, you know, obviously stepwise gets worse as a person gets older.
Yeah.
And as we wrap up, is there any last thought that you want to share about this?
I keep telling people, I mean, I'm a believer in vaccines, so since this is so similar to the flu, and we still are in flu season, you know, talk to your doctor about getting a flu shot, because the last thing you want to do is to have something circulating in your community, you get symptoms that are similar, and then you have to go through that anxiety. Flu shots are not perfect, certainly, but we know that they can reduce illnesses. They can also reduce hospitalizations. So, you know, my thoughts are do all the things that you can do to make yourself healthier. Sleep, get a lot of sleep, make sure, you know, you hydrate, do all the things that you know are going to make yourself, you know, as the best you could be. And so that's really what my recommendations would be. It's what I'm telling my children to do. So they don't always listen to their mother, but.
I definitely want to, that's great. I think that's a great reminder for all of us, you know, to do the things that we should normally do to protect ourselves. One other thing, I think, because it's such a novelty of the coronavirus, is that there has been a lot of misinformation, and it's easy to agree with our own biases. So, you know, you see something that you agree with, it's easy to say, okay, that's likely what it is. And sometimes it takes a moment to step back and say, how valid is this information? Is the credible source that it's coming from? Is it helpful to me and my family and my community at large? So I think it's important to urge to look at credible source of information. The World Health Organization, the CDC, Florida Department of Health, they all have updated information on this that you can find and access. So the misinformation often not just makes it harder, but also makes it difficult to communicate the actual information you need to protect yourself and your family. So definitely look at the credible sources.
Just be careful with that misinformation. Absolutely. Absolutely. Well, we're going to wrap this up now. I want to thank Dr. Lakshmi for joining us. We're going to continue to keep you posted on updates about coronavirus on Fox 13 News, fox13news.com, plus Facebook and Twitter. Thank you so much for joining us.